We're talking about spaceflight technology, but you don't have to go to space to harness this, and it's actually vibration that we're looking at. So what are we going to do? Hopefully understand what whole body vibration training is, and importantly, what it isn't. A lot of skepticism, even from the most kind of respected therapists and physios, etc., in the field. You know, is it really a thing? Is there an evidence base to it, and how the hell does it work? How can we use it? And then a little bit on the history of whole body vibration and its evidence base and application in space flight. So quite a bit to get through. So you appreciate, I'm not going to go to the ultimate depths of every single one of those, but hopefully enough for you to take away some useful, interesting and useful techniques should you want to go further. So what is whole body vibration? When you think about whole body vibration, maybe some of these things come to mind: perturbation, shaking, unbalanced, not necessarily positive words. You might have seen these kind of things on Amazon. Fantastic things where it can shake away the cellulite from your body. Yeah, right. Okay. So again, it's not really looking that good for whole body vibration at this moment in time, nor is it if you come from construction work and you think about white finger and you think, well, really? You know, so you sat here, you're hopeful. It's not all of that. It's not about this either, okay? This is not what we're talking about. Do you remember these? The older of you in the audience, somebody sat there going, what, that? I think my aunt had one, and it was great for us to play on as kids age about 5. Olivia Newton-John did a great advert for this. It's not this either, okay? So we've got that out of the way. This is really not what we're talking about. We're going to talk about something different, and I guess you're wondering, what the hell has it got to do with space flight? So what is whole body vibration? So whole body vibration training is a form of training that uses an external drive to stimulate the muscle. Okay, so that's one definition. And that's usually delivered standing, sitting, however your patient's positioned, on a plate. Now, you've got different types of plates. Ones that kind of side oscillate and kind of do that. Like my animation there, it's a pretty good one. You possibly, if you're not familiar with those, you might have seen these things in your gym, the power plate. Okay, so we all went through a power plate revolution, didn't we, a while ago? They're different, okay? They're different. They go vertically up and down rather than side to side. And if you've ever stood on those with straight legs, you'll know about it, because so straight knees, it's quite uncomfortable in the head. So that's the kind of thing, that's what we're really talking about, none of the other stuff. So how does it work? Has anybody used vibration? Anybody stood on a vibrating plate intentionally? Yeah, okay, great, yeah. Did you feel the musculature contract? Did you feel it work? Yeah? Oh, yes, yeah. So how does it work? What is it doing? Well, clearly it's not just kind of shaking the muscle and you're feeling that. There is this response that exploits the muscle spindles. So the muscle spindles, as we know, are sensitive to stretch. So we know, kind of tap the tendon, and you get this monosynaptic reflex, so you get a twitch of the musculature. I'm sure you're all very au fait with this. So what happens when we stand on a vibrating plate? Well, if one side goes up, so let's say on this example here, that person's right leg goes up whilst they're squatting on the platform, that might induce a stretch in the quadriceps. Okay, so we might expect an EMG response from that, so the musculature kind of responds. But this is happening multiple times a second. So that frequency is called hertz. So if we're saying something like 30 hertz, that's happening 30 times in a second. So you get multiple and repeated stretch reflexes, and that's called a tonic vibration reflex. And what you then see is this interference pattern and a sustained EMG response. So it's a contraction induced into, or externally, if you like, induced into the musculature. So whereas you kind of squeeze your muscles and contract your muscles or push or pull things against resistance. This is a kind of externally driven by exploiting the muscle spindles. If you've not seen it, this is kind of what it looks like. Forgive the lack of clothing here, but this is 30 hertz, and then I've just slowed it down so you can see, I won't spend much time looking at this, but you can see really what's happening. So you can see my hands moving, and you can see the musculature contracting, and obviously the muscles that are controlling or resisting that movement. You have no idea how much cutting I had to do to this video. I'm joking. So you can see that at the end, you've got the triceps. Let's focus on that. The reason why I put this video up is because afterwards we kind of realized we've got a good visual of this, what's going on. So on the left-hand side, this is without vibration. And this is not scientific, this is just for visual purposes. You can see the definition, if you like, of the tricep muscle group. On the right-hand side, this is with vibration. So there is greater muscle tonicity, there's a greater level of muscle contraction, and that's what happens. So superimposing these vibrational stimuli in this manner means that there's a greater activation of the musculature versus me just being in that position without the vibration occurring. And we see this increase in EMG amplitude. And it's not just pictorially. There is a strong evidence base. So hopefully you know by now, if you've ever heard me speak before, everything I talk about has a strong evidence base to it, else I sound a little bit stupid. So in terms of whole body vibration, we can see just one example here. This is on a vertical plate, a plate that displaces vertically. But just to illustrate, so this is individuals, so this is at 30 hertz and this is at 50 hertz. This is individuals standing on the plate, the EMG of the quads, if you like, so the amount of electrical activity in the musculature required to sustain that position. Then with superimposed vibration, we get an increase in muscle contraction. So hopefully this is starting now to make sense. If you've got people that are load compromised, can we almost augment muscle contraction to start to develop muscular strength and the ancillary benefits we'll get from strength training? Now, I said the vertical and side oscillating plates are different because of a multitude of different things. But if you're standing on a vertical plate that's going up and down like this, yes, it has an effect. Sometimes it's not very well tolerated. Again, if you've stood on one at 50 hertz, you might understand why. But also there's an attenuation and a dampening of that vibrational frequency as it goes up the limb. So the whole of the lower limb is going up and then down, or all of the lower limbs, all two. But on the sinusoidal or the side oscillating plate, that doesn't happen. So for each frequency, so you can compare the frequency here, 30 hertz, 2 millimeters of displacement, which is quite small, but still significant. What you can see is just taking any of these muscles, the vertical displacement shows this amount of electrical activity, which is less than achieved by the sinusoidal for every single muscle group evaluated. So that means the amount of vibrational frequency you use or need to input is relatively less, and actually it's a lot more pleasant. So what's the context to this? Well, we're talking about maybe injury, disuse. There's a whole raft of this research in neural populations, and maybe somebody kind of suffers an injury. Maybe there's a joint stiffness, a joint soreness associated with osteoarthritis. And then what can happen quite quickly is you get this spiral of decline when people disengage from exercise because it's painful, because they don't educate, you're not educated, because they're load intolerant. So what we want to do is when they become symptomatic or when they're deconditioning, is there a way in which we can intervene to attenuate that, stop that from happening, and indeed redevelop that? And this is where the astronauts come in, right? So you go into microgravity, then you no longer have the gravitational forces acting upon the skeleton. So this has efficacy in bone as well as the musculature. And you see these tremendous declines in musculoskeletal health associated with space flight. So we said a kind of strength and load compromised populations here. So deconditioning is associated with sarcopenia. So could this technique be used in individuals who might be at risk of that, whether that be age-related, whether that be injury-induced, whether it be space flight-induced? So we've got a reduction in muscle strength, power, size, volume, but not only that, we've got the interruptions to the drive to the musculature, rate of force development and power is impaired. So are the quality of the connective tissues that transmit muscle force to bone. And indeed, bone itself needs stress to remodel. So you take away that stress, and that also then becomes less healthy, if you like, or less robust. But when we're talking about load-compromised populations, older individuals, people that are injured, like, whoa, hang on a minute. No, we're not going to load them heavy because they're patients, because they're in pain, because they're load intolerant, and we immediately think about removing the load. Whereas high loading is better for muscular strength adaptation, for bone adaptation, for connective tissue adaptation. But what do we do when people are load intolerant? You know, you've got these clinical considerations. Could, therefore, this be one application whereby externally produced high-intensity muscle contractions can help us? And again, a lot of the commercial literature kind of stops us thinking about these things because we've got these stupid claims with kind of 50 quid plates off Amazon that, you know, enable you to, as I said, literally shake fat off. So that's what it's got to do with space flight. So you're thinking about the changes that occur in microgravity, similar type of consideration when we're thinking about individuals who are load intolerant, load compromised. We've got a reduction in their stress and indeed the ability to stress to cause these adaptations. And some of the classic studies, even not in space flight, but just literally immobilizing a limb in a plaster cast can cause almost a 10% reduction in quadricep strength. These are healthy individuals. In 5 days, almost double that in 14 days, similar to muscle cross-sectional area. Put somebody in bed, you can maybe expect almost a 1% reduction in bone mineral density per week. So if individuals are load intolerant, what are you going to do? So the application of whole body vibration is, we've got it in sports populations, so we can use it to augment performance. But what we're really talking about, and again, this is a snapshot of the evidence base, we're talking about clinical application here. Is it efficacious, advocated in clinical populations? So we've got whole streams of research on NEOA, we've got it in MS, we've got it in cerebral palsy. Belinda Beck's just about to publish her results from her VIBMOR trial looking at osteopenia, osteoporosis, and on bone. Even in stroke populations. So there's a very strong evidence base there. And in the Mars 500 study, where a few individuals who volunteered for this were put into an environment that, as best as possible, could simulate that of Mars, obviously, you know, kind of zero gravity, microgravity there. We've got an expected loss to musculoskeletal health. Some of the interventions that they looked at trying to prevent that from happening, one of which included whole body vibration. And indeed, when you look at the countermeasures, that performs very highly, in fact, the highest in terms of preventing loss of muscle force in this example, compared to other things. So how do we implement this? So I'm going running through this quickly. Exactly the same as you would implement something else in terms of exercise prescription. What are you trying to do? What's the stimulus that you need to do it? And can you keep progressing that? And it's the same for whole body vibration. What's your goal and how are you going to achieve it? This is where, you know, when you think about strength adaptation, you think about load, you think about reps, you think about sets. This is where things like frequency matters. Again, why you can't take a cheap plate off Amazon, stand on it and think, ta-da, you know, that's going to be great. Because you've got no way of modulating these important factors. What's the frequency? How many times is it vibrating? Is it moving per second? Is it the same if like a 10-kilo person stands on it versus a 100-kilo person? If it's a cheap bit of plastic, probably not. And therefore, you cannot control that dose. And the response that you're going to get, what is the response you're going to get? So to broadly tell you, to optimize strength, stroke power adaptation, we're talking higher frequencies, kind of, you can see here. Incidentally, if you go to wholebodyvibrationeducation.com, you can download this free guide. It'll give you this, okay? Function, slightly less of a frequency. Balance, again, slightly less. So we're thinking about perturbation. That's all to do with the latency of response of the input and then the response back. Can you cognitively perceive that or not? Is it happening too quickly? So different frequencies train different things. And just to quickly, I know I'm kind of running out of time here. How much time have we got left? So this okay, I'll hand over to Harold now. This is an example of a study that shows specificity. 3 sets of 3 minutes at 20 hertz was what they did on standing on a plate. Now you think about 3 minutes of exercise. Is that going to enhance strength and power? We think about that from a normal conditioning perspective. You think, well, actually, no, because surely they're going to fatigue. And indeed, the results showed that there was an improvement in function. Okay, so there's at the frequency, 20 hertz, we've got an improvement in function, but clearly there was no change in muscle power because the intervention was too long, we were fatigued, and it wasn't specific enough. I'll just skip through that study. So just to say, this versus resistance training, I'm not saying this is superior. I'm not saying this is superior. I'm saying it's an important adjunct when you've got individuals who, for example, are load compromised, who have got no voluntary control over their own muscle contractions. And this study kind of illustrates the potential gains that you can get from that. Okay, again, if you write this down, okay, so consider your patient's current baseline capacity. Think about what you want to do, how are you going to do it, do you have the equipment to do it with? Those are the important things from that. Write the wholebodyvibration.com website down, and you can download this for free. It'll tell you all of what I've just told you there. And I've done a course on this. You can get 15% off through with that discount code. So write that down now, intro 15. If you want to take this a little bit further. I'm going to hand over to Harold now, who's an exceptional engineer who's involved, basically Galileo is him.
Thank you very much, Claire. Thank you. So I try to keep it short. So I just want to point out the history of Galileo, why we have developed the Galileo. And so we are more than 30 years in the bone-muscle field where we can quantify this bone-muscle relationship with a small computer tomograph. And so the boss of the bone is the muscle, and the boss of the muscle is the neurological system. And if you can act with nutrition, drugs, hormones on the muscle, on the bone, or on these osteoclast, osteoblasts, but the message is you will never replace the training. Sorry, So you have to train to maintain bone and muscle. And so and one first important research result is, so to get adequate forces to the bone, we have to have good muscle function. So normally only under eccentric condition you are producing these high loads which are necessary to maintain the bone. The second thing is, or here you see this, so if you induce high forces to the bone, so the bone acts in adding bone at the outer side. This happens in children. So first they get the higher muscle forces and then the bone is following. And so the bone is increasing, and you can see it here, so the bone getting bigger. And this happens in children. The opposite you have if you immobilize people. If you have just low deformation, if you have stroke or spinal cord patient, then from the inner side, bone will be removed, and the bone getting thinner. So, and this works all our life long. So let's say you are until 18 years old healthy, then you get a motorcycle accident, and then you get this reaction of the bone. And so the next important thing is when we talk about elderly people, we know that you get only peripheral fractures normally when we are falling. And there's also some research showing this. So 90% of the hip fractures or radius fractures are related to falls, and even more than 50% of the vertebral fractures are related to falls. So the second thing is that we need to prevent the falling, and falling means, again, good muscle function. And so the starting point for Galileo was how we can train elderly people or deconditioned people. We had 1996, the Galileo patent, 2004 we registered as medical device, and we have now, since 2019, more than 400 scientific publications in different fields. And so what makes it so unique? So we see the Galileo as an additional tool where you can do something which you can't do with these conventional things. So maybe you do endurance exercise like cycling, swimming, running. You do resistance exercise like weightlifting, resistance exercise machines, coordination and balance, functional training like sit-to-stand, walking. But with the Galileo now you have an additional tool where you can do something which you can't do with these conventional things. And the first thing is that we are stimulating the system from the outside, like Claire has shown. The second thing is that we can train the high muscle power which is necessary for fall prevention, but only applying small loads. So even patients with joint problems or even children with osteogenesis imperfecta can use this kind of training. The next thing is that we can train the high power, but the influence on the cardiovascular system is very small, so heart rate or lung function doesn't increase during the training, and this is also very well tolerated by heart and lung disease patients. And the last thing, which is very important when we talk about muscle function, we need a high repetition rate. And so here you do maybe 2 repetitions, here maybe 5 repetitions per second, but with the Galileo now you can do up to 36 repetitions per second, and this leads to a much better intermuscular coordination. And since we have now influence on the muscle, we have influence on the bone, but also to improve muscle function. And this was the reason why we have done many studies now with the European Space Agency. We have done 2 battery studies, and the last battery study was able to show that a 50 minutes training a week was able to maintain bone and muscle. We have done this parabolic flights to show that we can do this training under microgravity condition. We have this done isolation study it takes about 500 days to go to Mars and backwards. And one of the last things is that we have now implemented this Galileo in a centrifuge, because they know that it's not enough to maintain only bone and muscle, but we have to also to stimulate the neurological system, and then they do this training up to 3 Gs in a centrifuge to maintain bone and muscle. And that we can also the other side. So we do it, for instance, also with these children with spinal muscle atrophy. And there's now a very expensive drug. It costs about 1.5 million. And if you have the drug, then you need to exercise. No drug will improve function or maintain bone and muscle without exercise. And here we do the training even with little kids, that they can get a muscle function, muscle, etc. Thank you very much. So here again you see different applications. So we have for the upper extremity, the dumbbell, for patients who are not able to stand, the tilt table, smaller tilt tables, or the normal standing devices. Thank you very much.
Is there any contraindications that we need to be aware of before using this?
Yeah, as in with anything that you do, there's kind of indications and contraindications. If you want to send me an email, I can give you a whole list of them. But things like some of the things like joint implants, for example, they are contraindicated. However, more recent research is looking at doing research with joint implant patients because it came from opinion. Will it shake the cement off, for example? But yet that's a clinical application. If we can't load up those individuals, can you use whole body vibration? So some of them are being questioned, but yes, clearly that there are some. If you wanted to elaborate.
Yeah, so basically there are 2 major ones. There's acute vein thrombosis and artificial implants only as a precaution. We have a lot of therapists and doctors which themselves has these artificial hip implants, but we have no large study in the moment. We know that 1-2% of these artificial joints are loosened by something else. bad bone, bad surgery, and therefore we need more research to say you can use it. But we have private people in Germany or in other countries which are using this technology also. On the other side, stents, shunts, pacemakers, screws, plates are no contraindication. But the two major ones are deep vein thrombosis and artificial joints in the moment.
There has to be a limit, surely, because certain internal organs can only handle, I'm assuming, so much vibration. I'm thinking about the brain and concussion.
Yeah.
Any comment on that?
Yeah. So throwing back at me my courses. No, it's good. Met Francine for the first time today, having seen each other online. Nice to meet you again. So absolutely, I'm not suggesting that we continue to ramp up the frequency. I'm thinking about get the basics right, what you're trying to affect, get the overload right, and then monitor it, seeing where you're making progression. So from that perspective, just standing on a plate that you've bought, that you're not able to understand what the vibrational frequency is, and indeed whether that's attenuated if you've got people of heavy mass versus light mass are on the plate, that's going to change what you're doing. If you get all of those things right, this is like leaps and bounds of step further than in terms of exercise design on vibrational plates compared to what's happening currently. So in terms of the progression, it might be that ultimately your end progression is doing heavy load resistance training. That's where you get. Now, I'm not suggesting that you continue ramp up frequency like 1600 hertz on a plate. No, I'm not saying that. I'm saying if you want to change strength, do high load, low repetitions, high frequency, low duration. If you want to change perturbation, balance, sensory motor performance, maybe use a lower frequency where you can modulate that, so you have actually got a conscious awareness of it and you're able to respond, but very, very subtly and quickly. Then you'd use that type of frequency, and then your progression of that might then become in the real world. It's an important adjunct. It's not the be-all and end-all of everything, but it really will facilitate that journey to real life. If indeed you're not able to achieve that in really compromised patients, that might be your lifestyle that enables you to live. If you've got chronic spasticity or whatever it is, you're unable to walk properly, that might be something that unlocks that for you.
But I want to add something. So first of all, the vibration you have on head level is far, as we talk about 0.2 G. So you never have problems normally with the head. So normally the limiting factor is really the neuromuscular system. So for instance, in Germany, there's a home-based training program where handicapped children with CP, Duchenne, etc., they train 10 times a week, and we talk about 10 times 50 minutes block. So 2 times a week, 2 times a day normally. So really, you cannot compare what you have in occupational medicine. Occupational medicine is a mixture of frequency. When we use the Galileo system, for instance, we have a pure sinus wave. It has nothing to do, and in occupational medicine, they have never investigated side alternating systems. There's only vertical systems. And vertical system creates these problems, but not with a side alternating system.
Have there been any studies done with osteoporotic patients?
Yes, there have been certain. Again, the first thing is in the osteoporotic population, avoid the fall. So the neuromuscular competence is much more important. And I'll give you an example. So for instance, in the Japanese population, between 65 and 70, they have just 1/3 of the hip fracture than the European woman. Why? Because the Japanese woman is used to go to the floor, to the ground, coming up. They have tatami. So their neuromuscular competence is much better than maybe a European woman. And therefore, the first thing is to keep neuromuscular function. So even if you have reduced bone strength, if you avoid the fall, you have a good protection. But again, also, if you want to improve bone strength, then we have to train to keep our muscles. And so if you get immobilized, I have not the slides here, unfortunately, but I should show you the slides, for instance, for a baseball player, where you see the throwing arm and the non-throwing arm, and you see this huge difference between the throwing arm and the non-throwing arm. You see the influence of muscle on the bone.